Okay. Well, the next question was related to thyroid. Was what is an endocrinologist? So I'll just better introduce myself. Just call me Dr. P. I'm just putting some of these online to try and help some of my patients. There we are. There's the dog. And I'm a doctor in Queensland, Australia. Endocrinology. Endocrinology is a specialty. What is a specialist? A specialist is someone who has completed a medical degree, which 6 years when I used to do it, but I think you have to do 2 degrees now, a science degree and then do a medical degree, so it's 6 years split up like that. Become a doctor. One of the requirements of being a doctor is that you work for used to be a minimum 2 years, but a certain number of years in the public hospitals first of all, and then you get your stripes. Then you can go and study to become a GP, or you can stay on in the hospitals and become a specialist. Everyone wants to become a specialist nowadays, which that'll be a subject of another debate. Endocrinology is one of the specialties. So a doctor who is an endocrinologist has done 6 years at medical school, probably then a couple of years of internship, then probably gone into studying for their advanced specialist degree in endocrinology. They probably would have been under an endocrinologist in the hospital as a registrar for maybe 3 or 4 years, done some final exams, passed those exams, and then they are a qualified endocrinologist. Just to explain what a registrar is they sort of run the public hospitals. He's an advanced trainee or someone who's training in a certain specialty. The consultants aren't there all the time, obviously. Some of them work in private as well. So the trainees run a lot of the departments and a lot of the units. So endocrinology is one of the specialties in hospitals and in private. Endocrinology is basically the study of glands and hormones. So they deal with, well, diabetes, but there are so many diabetics that the endocrinologists can't handle all that. So most diabetes is dealt with by general practitioners, but endocrinologists obviously deal with the very complex cases, probably with the young insulin-dependent diabetics and with people who GPs are having trouble controlling their diabetes. But so diabetes would be the number one thing that they deal with, but probably not, because general practice does most of the heavy lifting with that. They deal with thyroids, which is another gland in your neck. Diabetes, by the way, why that's a gland and relate to a hormone is that diabetes is the disease around the chemical insulin, which is produced by a gland in your pancreas by cells called the islets of Langerhans, I think. Better check that. So diabetes is a hormonal problem. Thyroid is a hormonal problem around the hormone, thyroid hormone. Your pituitary is the master endocrine gland. Pituitary is a small gland which sits in the base of the brain, almost impossible to get to, and it sends out stimulating hormones to all the sort of worker organs which produce hormones. So the pituitary, which is another area of, if you have something wrong with the pituitary, you'll probably be seeing an endocrinologist. It controls the master hormones which drive the other glands, such as thyroid stimulating hormone and growth hormone and ACTH. We'll have to do an episode on that, which is to do with your cortisol system. Produces prolactin, which is to do with producing milk in breastfeeding women. It produces the hormone FSH, which is follicle stimulating hormone, which is the hormone that floats down from the brain to the ovaries and causes the ovaries to produce an egg, hopefully every 28 days in a fertile woman from the age of about 12 to the age of about 45. So FSH is another hormone that can be measured to check on fertility, but there are a lot of others. We'll have to do something on that. What else? Parathyroids, which are little glands about the size of a pea. There's 4 of them, and they live in the thyroid, so they're in your neck as well. About there. They regulate calcium metabolism along with many other things, so they can cause problems. And if you've got irregularities in your blood calcium, which will be picked up on a blood test, then you may well end up being tested for parathyroid. And if you have parathyroid problems, you'll probably be seeing an endocrinologist. So, and there's probably several others that I've forgotten. But endocrinologists basically look after hormones and glands. They use a range. It's a very technical area, so they're doing a lot of testing to see which hormones are out of whack and how to bring them back into whack, and that can involve usually medications, but sometimes even surgery. If your thyroids are too overactive, you might get an operation of the thyroid. If there's something wrong with your pituitary, you may even end up getting an operation on that, but because it's in the base of the brain, they often end up doing radiotherapy. That's a very technical area, so if you have a problem with your pituitary, we better do a little episode on that. Obviously, no one operates on the pancreas to do anything for insulin. That's all to do with giving synthetic insulin, which is probably a life-saving thing for people who are completely insulin dependent. I will do a few on diabetes, or you could probably do 100 episodes on diabetes, explaining the difference between type 1 and type 2. Anyway, that's long enough for that, but that's just a brief introduction to endocrinologists. Endocrinologists, you could see one through a public hospital. There's not that many of them in public hospitals. They probably have long waits. If a GP refers someone to an endocrinologist in a public hospital, it may well be that they're going to say, no, that's something that you can look after, so go away, in which case the GP is then expected to look after it. If it's a very complex case, the endocrinologist may see the patient. Endocrinologists work in private, very, very thorough, intelligent doctors, obviously. They have to know a lot. If you're referred privately to an endocrinologist because you're having problems with the diabetes or your thyroid or something, it's not going to be as expensive as going to see an orthopedic surgeon or some of the other sort of plastic surgeon. It's you're probably going to be up for maybe a couple of $100 for the visit, but it's well worthwhile because you're really not going to have to go back. You're not going to have to go into hospital and be admitted. You're going to get the advice from the total expert. So yeah, if you do need to see an endocrinologist, very, very, very smart people. Might cost you a couple of $100. Go privately, yeah, well worth it. People spend that on because they're going to the vet for their cat. Anyway, that will do for today. That was episode. Just filming up here. If you've got any questions, put them in the comments. Thank you very much. Bye.